Добрый день, глубоко уважаемые коллеги и гости. Сегодня 25
Dear colleagues and guests, today, the 25th of February 2021, 15:00 Moscow time. Let's me start the dissertation committee session dedicated to the defense of the dissertation by Alexandra Igorevna Merkulova, seeking an academic degree of candidate of medical sciences in the academic degree field 14.01.01 Obstetrics and Gynecology, on the topic the role of androgens and aromatase inhibitorsin forming an individual approach to infertility treatment of women with poor ovarian response. And by the act of Academic Secretary of St. Petersburg University, Alexander Valentinovich Gnetov, dated the 21st of December 2020, I, Eduard Vladimirovich Komlachenko, Doctor of Medical Sciences, Associate Professor of the Department of Obstetrics, Gynecology, and Reproductive Medicine, St. Petersburg University, was appointed chairman of this dissertation committee. Other members of the dissertation committee include Alla Stanislavna Kalugin, Doctor of Medical Sciences, the Associate Professor of the Department of Obstetrics, Gynecology, and Neonatology of the First St. Petersburg State Medical University, St. Petersburg, and also Marina Anatolievna Tarasova online with us, Doctor of Medical Sciences, Professor of the Research Institute of Obstetrics, Gynecology, and Reproductive Health, named after Ott. Can you hear and see us? Yes. Nikolai Nikolaevich Rukhlada, Doctor of Medical Science, Professor, Head of the Department of Obstetrics and Gynecology in Pittsburgh Pediatric Medical University. Can you hear and see us? Yes. Vyacheslav Natanovich Lokshin, Doctor of Medical Science, Professor in the Department of and the Director of the International Clinical Center of Reproductive Health, Persona, the city of Almaty, Kazakhstan. Can you hear us? Yes. Yes. Also, of course, Alexandra Igorevna Merkulova, and also the academic advisor, Alexander Mkhtitevich Gzyan, Doctor of Medical Sciences, Professor of the Department of Obstetrics, Gynecology, and Reproductive Health, Reproductive Medicine, St. Petersburg University, to improve the quality of the communication. I would like to ask you, dear colleagues, who are online with us, switch off your microphones, but don't forget to switch them on when you're given the floor. And also, I would like to inform you that an audio-video recording of this session is broadcast online on St. Petersburg University website. Also, there's an electronic address where you can send your emails that relate with questions and comments relating to the discussion of the dissertation, accompanied by the signature by the person who asked the names and affiliation of the authors of the questions. No questions that have no relation to the academic discussion will be read in accordance with the order of awarding St. Petersburg University academic degrees of Candidate of Science and Doctor of Sciences. A session of the dissertation council is legitimate if not fewer than 4 people are present out of the established membership of the dissertation committee, and not less than 2/3. Well, we have all 5 people, including 3 people, members of the dissertation committee in an online distance mode. And I would like to go over the procedure. First item is a short presentation of the chairman of the paperwork submitted by the defendant. 5 minutes. Second, short presentation of the candidate seeking the academic degree that covers the research presented in the dissertation. Questions to the candidate, strictly on the presentation, not more than 2 minutes, and the presentation of the candidate not more than 15 minutes. Then answers of the candidates to the questions, not more than 5 minutes for all questions. Then all members of the dissertation committee will read their reviews, including the chairman, 10 minutes each. Answers of the candidates, 20 minutes for all answers. Then an open floor discussion. Anyone who is present here will be able to ask questions or make comments, but strictly on the presentation. Not more than 2 minutes per speaker. And please enter your name if you'd like to speak up into the logbook. And also number 9 is the chairman of the dissertation committee will read any questions that have been received by email, and questions that will take more than 2 minutes to read will not be read. Answers of the candidate, not more than 2 minutes per question. And then the academic advisor will have the floor for 3 minutes, and then there will be a deliberation time of 5 minutes before open roll call voting, and if needed, then open roll call voting and taking a decision on awarding or not awarding the sought academic degree, and the concluding statement of the candidate. Do you have any objections or questions on the procedure? If there are no objections, then I would like to go over the agenda. Please turn off the sound of your mobile telephones, but the people who are in the visual contact with us online, please don't turn off your telephones for emergency communication. The dissertation of Alexandra Igorevna Merkulova, seeking an academic degree of Candidate of Medical Sciences in the academic field, 14.01.01 Obstetrics and Gynecology, and the topic, the role of androgens and aromatase inhibitorsin forming an individual approach to infertility treatment of women with poor ovarian response, was accepted for a defense on the 2nd of December 2020. Alexandra Igorevna Merkulova wrote her dissertation research in St. Petersburg University, supervised by the academic advisor, Doctor of Medical Science, Professor of the Department of Obstetrics, Gynecology and Reproductive Medicine, St. Petersburg University, Alexander Mrtichevich Gutsyan, and the number of publications that cover the main points of the dissertation. Number 3 in the refereed journals of the Ministry of Science of the Russian Federation. No publications in the Web of Science or Scopus databases. The defendant submitted all the necessary documentation for the dissertation to be accepted for defense, and all the paperwork according to my knowledge that I received from the member of the Office for Academic Committee Management, they comply with the regulations. Before I give the floor to the candidate, do you have any general questions? Do we need to go over the whole package of the dissertation submissions? No. Then Alexandra Igorevna, you have the floor. 15 minutes for your presentation. Good morning, good afternoon, dear Chairman and dear members of the Dissertation Committee, dear colleagues and guests. My dissertation work is on the role of androgens and aromatase inhibitors in the formation of a personalized approach to overcoming infertility in patients presented to your attention. The relevance of this work is due to the fact that the weak response of the ovaries to stimulation, characterized by the production of 3 or less oocytes as a result of transvaginal follicle puncture in the IVF protocol using adequate doses of gonadotropins. It's a very common problem. Accompanying, according to various authors, from 5 to 35% of cycles. With a weak response of the ovaries to stimulation treatment, efficacy rates are low, and the incidence of early effective completion of treatment is extremely high. In 2020, in Bologna, a working group of the European Society for Human Reproduction and Embryo defined the weak response of the ovaries to stimulation, formulated criteria for predicting it. Prior to the publication of this consensus in 2011, the problem on insufficient ovarian response in ART programs was obvious, but not specified in the diagnostic aspect. Sorry. There's no... the microphone, there's a technical pause. Then prior to the publication, according to the Bologna criteria for a weak ovarian response to stimulation, the use of this definition is valid if 2 or 3 conditions are met. The woman's age is 40 years or more, to the presence of other risk factors for a weak response to stimulation. Decreased ovarian reserve, the number of antral follicles, anti-Müllerian hormone, the previous weak response of the ovaries to stimulation when using adequate doses of gonadotropins, 3 or less received, oocytes or cancer of protocol due to the lack of response of the ovaries to the stimulation. If a patient has a history of 2 or more episodes of the weak response, I cannot be sure that the microphone is working. Technical break is announced.
Ближе и дальше.
Раз. Сейчас еще 1 минуту. Сейчас они перезапустятся. Все. Раз.
Мне необходимо назад
Раз.
вернуться с этого момента.
Да. Раз. Давайте попробуем продолжить.
Технический перерыв номер 1 закончен.
The technical break number 1 is over. We continue. The goal is optimization of infertility treatment is assisted in assisted reproductive technology programs in patients with predictable weak ovarian response to stimulation through the use of androgens aromatase inhibitors. To achieve this goal, the following task was formulated to determine the clinical anamnesic characteristic of women with a predictable weak response of the ovarians of the ovaries to stimulation. Second, to assess the hormonal function of the ovaries in patients with a predictable weak ovarian response to stimulation to determine its dependence on the use of letrozole. The materials attached were clinical laboratory data obtained the results of examined patients undergoing fertility treatment using in vitro fertilization methods in the Department of Assisted Reproductive Technologies of the Research Institute of Obstetrics, Gynecology and Reproductive Medicine. Inclusion and exclusion criteria are listed on the next slide. To achieve the set objectives, 4 groups were formed. The first group consists of patients numbered 26 to whom from the 1st to the 5th day of ovulation stimulation along with gonadotropins, aromatase inhibitors at a dose of 2.5 milligrams a day were prescribed. The patients of the second group, numbered 38, were prescribed at the stage of preparation for, of the stage of preparation for the IVF protocol. From the 5th day of the menstrual cycle, testosterone was prescribed at a dose of 25 milligrams a day. Patients in the control group, 122, underwent standard stimulation of ovulation in the IVF program using gonadotropin-releasing hormone antagonists. Determination of hormone levels in the study at the start of the stimulation protocol and on the day of the transvaginal punction and blood serum and follicular fluid was carried out by the method of enzyme immunoassay. The assessment of the aromatase activity of antral follicles was carried out according to the formula proposed by a group of research from the Institute of Obstetrics, Gynecology and Reproductive Health. According to the results of the study, the use of letrozole along with the gonadotropins and the cycle of controlled ovarian stimulation made it possible to statistically significantly reduce the total and effective dose of follicle-stimulating hormone peroxide received. So On the basis of our studies, the following provision was formulated for the defense: conducting controlled ovarian stimulation in the in vitro fertilization program in patients with a weak ovarian response with drugs of aromatase inhibitors together with the gonadotropins can significantly reduce the course dose of the drugs of gonadotropins without reducing the total number of obtained oocytes, good quality embryos, and pregnancy rates. When we there was in the case of normal or ovarian aromatase activity, clinical efficacy and the control group was extremely low, while in the group receiving adjuvant testosterone therapy, this indicator was significantly higher. This made it possible to put forward the following provision for the defense: carrying out therapy with testosterone preparation, the stage of preparation of the IFR in a patient with a weak response of the ovaries, stimulation, and normal degree of ovarian aromatase activity is pathogenetically justified. We also analyzed the aromatase activity of antral follicles in the study group. As mentioned earlier, among patients with a predicted weak response with the ovaries to stimulation based on the assessment of the coefficient of aromatase activity, 3 groups were formed with a low activity, yellow color, with normal activity, orange color, and the predominant group with high ovarian aromatase activity, gray. When we conduct a correlation analysis of the relation between the age of patients and the activity coefficient of ovarian aromatase of antral follicles, we did not reveal, and in a comparative analysis of the age structure of groups of patients formed according to the degree of activity of ovarian aromatase in antral follicles, significant statistical differences were obtained. Contrary to the existing data on the increase of aromatase activity with age, based on our comparison, we can say that an increase in aromatase activity is most characteristic of patients with a predicted weak response of the ovaries to stimulation, younger than 37 years old. For those who are older and is not an age-related change in the activity of the enzyme, but a compensatory response to the hyperestrogenemia. The data obtained made it possible to put forward the following provision for defense: the activity of ovarian aromatase defined in the ratio of the content of estradiol in the blood on the days 2-3 of the menstrual cycle to the number of antral follicles is increased in most patients with a predicted weak response to stimulation, which is explained by the need in a more extensive steroidogenesis. We also analyzed the nature of changes in the levels of steroid hormones in serum and follicular fluid, depending on whether letrozole was used in the cycle of controlled ovarian stimulation, the increase in the levels of androgens, androstenedione, and testosterone in the follicular field, and the decrease of serum estradiol were pronounced and statistically significantly different. You see here the results of the so the you see that so the third defense, the first statement for defense is the following: The serum estradiol-testosterone ratio is associated with the duration of stimulation, that is, with the duration of exposure to a reversible aromatase inhibitor, since this period lasted for the first 5 days of stimulation. That allows us to propose this indicator as a parameter for assessing the aromatase activity of pre-ovulatory follicles. In order to identify changes in the level of steroid hormones that may be significant in terms of the onset of pregnancy, a comparison was made of the main indicators obtained in the study of follicular fluid and blood serum taken on the day of TDP, depending on the factor of the onset of clinical pregnancy during the IVF cycle. The only indicator by which the compared groups significantly differed was the serum estradiol testosterone ratio on the day of TBP. W equivalent 144, P 0.05, which indirectly reflects the aromatase activity of pre-ovulatory follicles. We analyzed, in order to determine the serum estradiol testosterone index on the day of the TVP, above which pregnancy is most likely, the ROC analysis was carried out, as a result of which a characteristic ROC curve was obtained. According to our data, the area under the curve AUC which indicates a good predictive accuracy of the results when using this indicator. The maximum sensitivity 85.71% and specificity 72.22% of the test was revealed under the index and was less than 1532.68. The odds ratio of pregnancy with the estradiol testosterone ratio and serum on the day of TVP above and below the threshold value was 7.0, 95% CI. The data obtained made it possible to perform the last provision for the ratio of estradiol testosterone and blood serum on the day of transvaginal punction is an indicator reflecting the activity of ovarian aromatase of pre-ovulatory follicles. Thank you. Any questions? Dear Alexandra Igorevna, have questions. The first one is the indicator, which we think that are possible to prognose the results of the treatment, is the ratio of estradiol testosterone. Can you use this test as a predictor in other groups of patients? What you know from the literature, and what's your opinion? And the second question is because when we use inhibitors of aromatase of androgens, you find the increase in androgens. You said that there's no verified, statistically verified change in the electivity of cycles of estradiol, and why this, and what's the pattern of using as far as the use of the predictors of pregnancy of estradiol testosterone in the blood serum. We use it with patients with weak response, who had not received aromatase inhibitors. The statistically significant ROC curve was not found, and the aromatase inhibitors were not used. As far as the predictors in other group of patients, I have never met that. I haven't come across this in the literature. As far as the second question, and the increase intermolecular levels of estradiol, because we prescribed aromatase inhibitors for a short period of time. They sensibilized the levels of androgens, and the negative feedback they generate the activity of androgens, and so this was the effect. Thank you very much for your answers. Can I ask a question, dear Alexandra Igorevna? When you look at these tables, there are very high results in all, and about the same in all, so 2 folliculars and 2 embryos. So what's the why? It's very hard to find such groups that are so compatible. Maybe you use some approach and selected patients in a special way. Well, there was no prior selection. Just the criteria of exclusion and inclusion to based on response. They are all the results are just the effects of the therapy. So to as a follow-up, time-lapse technology, was the time-lapse technology used, or just a normal biological laboratory method? Just the normal biological laboratory of the Institute of Obstetrics, Gynecology and Reproductive Medicine. Well, please, Eduard Vladimirovich. Alexandra Ivanovna, very interesting work, very presentation. You found the follicular increase of testosterone. How about the quality of ovaries? Do you have any data from the literature, the world literature, to prove or dispute this dynamic? Yes, there are some laboratory data that testify that the increase of follicular levels of androgens lead to such results. Patients that have lower level of androgens, the results of fertility and then pregnancy are increased. You see that, and there are some additional studies that with the pre-sport indexes that has to do with folliculars that were at the start and the folliculars of the moment of puncture. This is the correlation. in the quality of oocytes. There was no correlation with the levels. There's no literature that would prove the correlation. Well, this word, on the contrary, there's a negative effect of the lower level of the fluid. So this is the. Do you have any other questions? Dear Alexandra Igorevna, such a complicated group of patients with weak response to stimulation. Is the study of androgen profile important? In this category of patients, we recommend a standard checkup to define the coefficients of aromatase activity, because the low sensitivity of laboratory methods to low concentrations of androgens we recommend spectrometric analysis that are available and affordable, and this type of diagnostic that we propose is only needed in hyperandrogenal levels. Why did you choose this scheme from the 5th day preceding? Do you think that? So this lengthy impact of androgens, my point of view coincides with the established opinions that follicles affect the receptors of androgens after the stimulation. In 2016, there were publications as far as the clinical experience of using testosterone. And since then, there has been really a lot of studies, and the works that I have included, testosterone was used on the day 4 or 5. Since we didn't have any data from the literature, we couldn't do it a different way. Well, we could use testosterone with a low dosage for 60 days, and there's a group in which for which testosterone was could be prescribed. Any questions? Any other questions? If there are no more questions, then we go over to the next item on the agenda, to the reviews. Maybe after each would you like to receive answers after each review or after all the reviews have been read? What do you think? I think after each review, if we could receive answers, please. Thank you. Please, I would like to give the floor the members of the station committee. It's, for me, it's a great honor to speak in this venue. The station of Alexandra Igorevna. The topic the very complicated group of patients with weak response to stimulation. And so the reproductive methods should be optimal. We have so to generate any oocytes is important. This therapy that this station showed very many questions. In this work, Alexandra Igorevna showed that proves genetically in using androgens in this category of patients. Would like to point out that the markers are important, getting the markers, and patients with poor response, they can be used in creating models of prognosis of the results of treatment for such patients. I'd like to emphasize that the work of Alexandra Igorevna is dedicated to the optimization of treatment with aromatase inhibitors, and it's very promising area for research. The goals have been set and achieved. The relevance is there. The new assessment method for aromatase activity was proposed, and this is, of course, of great value. The practical significance is personalized attitude or approach to such patients that increases the effectiveness of treatment, and of course decreases the cases of erroneous therapy and or erroneous postponement of therapy. So these results can optimize the approach to these patients. Statistical treatment, the dissertation is very interesting to read, well written in good Russian, and the literature review is well written, and that really describes the problem of weak response, and And the other point I want to emphasize is a detailed analysis of the impact of androgens on the reproductive system of a woman, and follicular genesis in patients with a weak response, poor response. Well, the author knows this problem and draws upon a lot of foreign studies. The results are presented. I will not dwell on that. The third chapter has to do with the results. There's good interpretation of the data, and where the author compares the data, the findings in her study with the data from the literature. For each section of the research, unique statistical methods are used specific to each context that allowed the researcher to come up with valid results. And my conclusion is the work is a complete research work in which the results of the stimulation in patients with a weak ovary response with aromatase inhibitors are presented, and it has the results are of great theoretical and practical value, and therefore the work complies with the regulations, and the author of the work deserves the right to be awarded an academic degree of the candidate of sciences, medical sciences in obstetrics and gynecology. The plagiarism clause is not violated. Thank you very much. Will we continue? Who wants to be the second reviewer? Aldad Vladimirovich, may I? Dear members of the station, for me to be able to speak at this venue is very great honor. 15 years ago, I also defended my candidate of sciences degree, and when I received an invitation to take part, I accepted with gratitude. Alexandra Merkulovna's dissertation is dedicated to a very important problem in reproductive medicine, because there are many patients, pregnancy of advanced stage patients, and they have poor response of ovaries to, and the idea of using androgens is just as the hormone of growth and other additives has been on the agenda for many years, but the author integrated the role of androgens in the results of on the quality of oocytes and the embryos of very interesting groups that in which different drugs were used. these medications were used, and the significance of testosterone content is evaluated. I will not talk in length about the content, but I will pose some questions. Well, why are the postponements of there are no official prescription criteria valid for stimulation in group 1, and why postponement and treatment? Why was the embryo assessed on the 4th day, not on the 5th, as usually done? Other than that, the dissertation it complies completely with the requirements of the of St. Petersburg University. Complies with the procedure awarding academic degrees, and is of great value practically, for example, with ovulation stimulation. So therefore, the author of the dissertation, Merkulova Alexandra Igorevna, deserves the right to be awarded a candidate of medical sciences degree. Thank you very much. Nikolai Nikolaevich, do we have any answers to the question? Please. Thank you, Vyacheslav Natanovich. And of course, when we compared the groups in premature completion of the stimulation, there are some the indicators of the effectiveness of the treatment. Well, there was the response to stimulation that were associated with the effectiveness. The groups that received aromatase inhibitors and the control group had the same rate of cancellation, 30%. And there were a lot of reasons for cancellation that are not associated with the treatment. The one, for example, patient needed a cardio pacemaker be replaced, and then there's another one is a genetic testing of an embryo. But statistically, these groups didn't differ much. So what factor was the most predominant, age or the level of MG? To prognose the pregnancy, is the age is predominantly is a predominant influence. And then we used 42 years as the threshold level. AMG, there was no AMG threshold level. And then the third question. Do we need a third question to be asked again? Why do we assess the development of an embryo on the 4th day, but not on the 5th as usual. The process was done. The prognosis treatment examination was done between the 3rd and the 5th days. On the 4th day we had more sampling of the results of the treatment, but the examination was done on every day of cultivation. Nikolai Nikolaevich, thank you very much, Eduard Vadimovich. I would like to thank all members of the station committee and greet them all. Slav Natanovich, we couldn't see each other if not for this COVID era. Well, so there are some positive sides. You can see this. You can see no negative impact on the quality of the station we can see today. I'm very grateful to all, to the university. I will not read my review in full. I will just say in my own words, very interesting work, which is built on a classical scheme. It has all the necessary sections, complies with all the requirements of dissertations for kind of sciences degrees. As the relevance of the topic is obvious, and because we are at the verge of an epidemic of a weak response to stimulation, but also the exhaustion of the ovaries in general. The fight for every pregnancy, for every newborn, for every fertilized egg. We after many years, the population of Russia has increased very little. So these efforts of the dissertation researcher are invaluable, and the value of this dissertation will grow in the future. Good language. I have no critical remarks of principle significance, but I have maybe a recommendation which Alexandra Igorevna could use in her future work. Very interesting figures of prognostic significance of them, estradiol and testosterone, all these indicators. This could lead to a patent, and having a patent will not only adorn your future work, but it could be a sort of a completion point of the research that has been done. So I really advise you to take care of it. And as just to say that this research has to do with a very important topic, very difficult patients to treat, but the station as a formal conclusion is completely complies with the requirements of awarding academic degrees of kind of sciences in St. Petersburg University, and the author of the work deserves the sought academic degree in gynecology, obstetrics and gynecology. So I would like to thank the research advisor, Alexandra whom I respect very much, for this. This father could not have had a bad child, and I totally endorse this paper, this thesis. Thank you very much for your recommendations, Marina Anatolievna. Dear Eduard Vladimirovich, dear colleagues, for me it's great honor to be here and in a leading institution, research and teaching institution in Russia. I work in the Institute of Obstetrics and Gynecology, and I'm very happy that the work that was presented here in a very high-level way has been based on the results of the clinical tests of the institute, and this is a follow-up of our previous research, ongoing research on reproductive health is to, the studies how to overcome infertility in women, and this problem has no practical algorithms in practice, and so the recommendations that are contained in this research thesis are very important for patients who suffer from this ailment. We heard this question as a demographic factor. The number of children have been born after reproductive technology used is not only the happiness of their parents, especially mothers, but also is a contribution to the demographics of our country. There's a growing number of such children among newborns in St. Petersburg and Moscow. The goal of the work of Alexandra Igorevna is validated by this survey of literature. She showed that the issues of androgen content medications can lead to positive results as affecting the follicles and the development of concrete protocols of using this medication are far from practical implementation, and this work has put this future closer to us, and the author presented a lot of theoretical findings the thesis is can be an example to be followed in a dissertation, because the sequence of the sections is very logical. They follow each other and they are connected to the goal, overall goal, and the tasks. And the groups, the choice of the groups for the study is absolutely substantiated, and the work has a very high practical significance, but it's also combined with theoretical contributions. I will not repeat what has been said before me. I will just say that the work makes a good impression. Just Vyacheslav Natanovich, please return to the screen, because this is important. The results of the research will contribute to the development of a personalized approach to identify therapeutic course for women with a prognosed predicted poor response of ovaries. From a practical point of view, this is a very important issue. So the data that have been obtained have been already implemented in the institute, the Otto Institute, and other centers could use these findings as well. And just my recommendation again to continue this work. She's a doctor and she's a researcher, and she has potential for future work. There are no drawbacks, and as far as the language, as far as the stylistics, I will just formally state that the dissertation of Alexandra Igorevna Merkulova completely complies with the procedure of awarding academic degrees in St. Petersburg University, and Alexandra Igorevna deserves the right to be awarded the third degree. Thank you very much. To conclude, I will read my review on the Alexandra Igorevna. I will not dwell on the details. The relevance is there. High level of methodology and research. All the goals have been achieved. I will just read the dissertation is a complete research work which presents an algorithm of treating patients with a poor ovary response to stimulation. It contributes to the development of a personalized approach to the treatment of such patients. The dissertation complies with all the criteria of set in the procedure of St. Petersburg University of awarding academic degrees of Candidate of Sciences and Doctor of Sciences, and therefore Alexandra Igorevna Merkulova deserves the right to be awarded the sought academic degree of Candidate of Medical Sciences in the degree field 14.01.01 Obstetrics and Gynecology. Dear colleagues, all the reviews have been read now, all the questions have been asked, and therefore I will also inform you that that I have no external reviews. Are there any members of the audience who would like to speak? No, no one wants to speak.
Так, у нас
Out of the questions by mail, we have
так, к нам поступил
we have received only one question from Habibul Violetta Maksuton, Master of Public Health and Social Academic Status, Independent Researcher. The questions for the defense. Well, technical question on how, if the slides were not clear, if you, so what's the date of what's the protocol of the research, what date, how many patients did you look at, and how many refused to participate in the study, and what the reasons are, and what about why did you exclude over 42? To understand the questions. Well, this is a very complicated question, so if you could show it to me so I can read it. There are a number of questions there.
Видите, да? Видите?
Well, you see this on TV in front of you. The research was approved by the institution where I conducted it.
в микрофон, пожалуйста, говорите.
Could you speak? Could you use the microphone, please? What is the period where we selected people for the groups? The period between 2016 to 2018. So, as far as the criteria of inclusion, the only patients that received inhibitors of aromatase, they were included in the groups. Later, after this relevant decision of an ethical committee, there from the 400 patients were examined before they were included after meeting exclusion or inclusion. Half of the patients were excluded. Patients that were included, no one refused to participate. All the criteria of exclusion were listed in the presentation. There were no other criteria. Why 42 years? Why there are Bologna criteria after 40 years? For example, well, the patients could be younger than 40 because if a patient had a poor response, they could be included. It's just Bologna criteria. If there were no limiting age, though, the upper age, we could not have a representative sample. Another question. The results depend on the methods. How to solve the problem and what statistical method of that was used. Yes, do you understand the question? Well, for every task, I have to go over the statistical method. Well, the first one, there are different. Well, the first study is clinical and anamnestical with the stimulation of patients with prognosed weak ovary. There's a method of identifying aromatase activity to identify the predictive significance of stimulation. For every method, we use statistical methods, and statistical methods played key roles. The method of treatment, including microscopic method in the assessment of embryological stage of treatment. The fifth task, it was to develop a personalized approach. We used all the methods that I have already mentioned. What would you change in the methods of statistical interpretation? I think that I would not change anything because these methods are good enough to achieve my goals. And the third question from Violetta Maxson. You compared your findings with other studies. What would you recommend for practical use? For what population of patients? Your question. I would like to start. What population of patients? I think with patients with weak, poor response or prognosed poor response. we could use in practical in practice, in medical practice, we could use to say this recommendations and for the checkups of because aromatase activity assessment do not need any complicated, sophisticated method. Also, patients are recommended to have treatment in accordance with the results of their aromatase activity, especially in the group of patients who have had failed pregnancies and who have decided to use donor cells. Well, all the practical recommendations can be used. That I have in my dissertation. There are no other questions. So, therefore, Alexandra, please, Teachevich, tell us about the candidate. Dear Eduard Vladimirovich, dear esteemed members of the dissertation committee and guests, I'd like to say that about the history of this work and Alexandra Igorevna. This work is ideologically connected with the studies that had been completed before Alexandra Igorevna started her research life, and was even under my research advisor. They had to do with ovarian aromatase. In this work, we tried to implement these ideas, and due to hard work of the candidate, this has become possible. Alexandra Igorevna is a very curious person who can work with academic literature from the very start, even as a student, undergraduate student. She was interested in research, and we actually were sure that she would become a researcher. And the logical sequence of her undergraduate work was this work. And the work that she did in clinical residency program. We went through a lot of work that gave her professional growth and skills, and now we have a well-established professional of reproductive medicine. The quality of the work is up to you, and I'd like to thank you all for taking the time to participate in this committee. Thank you. Dear colleagues, since we are communicating with some members of the dissertation committee via online technologies, communication technologies. Do you have any questions or objections to the procedure, technological procedure of the dissertation committee session? No. We have, before the open roll voting, we can have a 5-minute break to discuss and switch off the broadcast. Do we need such a break? No, we don't. Do we have any other opinion? No. There was nothing that could generate discussion. Deliberation. So we are continuing our session then. So I put to the vote the issue of the resolution to award Alexandra Igorevna Merkulova an academic degree of candidate of medical sciences in the degree field 14.01.01 Obstetrics and Gynecology for an open roll call vote. Just to remind you that the decision of a dissertation committee can be deemed positive if not more than half or 3 members of the dissertation voted in favor. Alan, Stanislav and Kalugin, your opinion? I vote for the resolution. Member of the committee, Marina Anatolia Tarasova, your opinion? I am in favor. Member of the committee, and Nikolai Shuruk-Leda, your opinion? I am in favor of the resolution. Member of the committee, Vyacheslav Natalovich Lokshin, your opinion? I vote in favor of the resolution. I am the chairman of the committee, Eduard Vladimirovich committee, vote for the resolution to award the third degree. Therefore, dear colleagues and guests, I would like to announce that out of the 5 members of the dissertation committee, 5 voted in favor of the resolution to award the third degree. No one voted against, and no abstentions. So the decision to award Alexandra Igorevna Merkulova an academic degree of candidate of medical sciences and the degree field 14.01.01 Obstetrics and Gynecology has been taken. Dear colleagues, because our session included online communication, do the members of the dissertation committee or members of the audience any objections to the procedure? Please. Can I have a question from another country? The diploma will be received right after the defense, or the higher station committee will approve it? That's the technical process. So, unfortunately, I cannot answer this question. Do you have any other questions? No. No objections. Thank you. No questions. Thank you very much. Therefore, the floor is given to the candidate. Dear Chairman of the Dissertation Committee, dear members of the Dissertation Committee, thank you for participating in this session, and irrespective of where you are, and thank you for the good words that you had to say about my work. I'd like to thank my academic advisor for the freedom in making decisions, for the support after these decisions, and the very and the warmth in coordinating my work. And great gratitude to the staff of the Obstetrics and Gynecology and Reproductive Health Institute, because without the staff and laboratory staff and from the heads of the department down to the nurses, everybody was supportive. I'd like to thank the head of the department of obstetrics and gynecology in carrying out my research, and I'd like to thank Valeria Halasovna, who has contributed to me becoming a researcher, and thank you to my family who supported me throughout my research period. Thank you. Colleagues, any good words? Congratulations. Just yes, an informal. Thank you. Congratulations. The candidate, my candidate degree was the idea of my candidate science degree was the idea was belonged to Mr. Gdian. Thank you very much. The session is over. Thank you very much. Please switch off the broadcast. Thank you.